Welcome back. It's 1221 at 1260 WRC. Andy Parks live from the Washington Times, and I'm joined now by another Andy, this one Congressman and Dr. Andy Harris, representing the 1st District of Maryland. Congressman, good afternoon. How are you?
Good to be with you.
President Obama takes the victory lap at the White House, says there's no going back now, no repealing Obamacare. It's time to move on to other things. Is that just wishful thinking?
Well, he's going to have to convince about 60% of the American public that it's time to move on because, in poll after poll, about 3 in 5 Americans say they're dissatisfied with the Affordable Care Act and, it needs to be changed. So I think in the end it's going to have to be changed, no matter what the president's wishful thinking is.
He claims 7.1 million people have enrolled. Do you buy that number? Is that a legit number?
Well, you got to define what enroll is. I mean, if the purpose of the Affordable Care Act is to get people who didn't have insurance to buy an insurance policy, the latest estimate we have from the RAND study is that of that 7 million, there are probably less than 1 million who actually paid for insurance who didn't have insurance before. Wow. So that's not a whole lot of people. That's a drop in the bucket to solve the problem we have in this country with the uninsured, and it was a mighty painful way to get there.
Yeah. By the way, he warned the press of other problems that could pop up along the way, but that really wouldn't be news, he said.
Well, he certainly doesn't want it to be news, but the next shoe that's going to drop is when the premiums begin to come out for next year's this November's sign-up period. Those premiums are going to start being released to HHS for approval within a month or two, and all projections are you're going to have double-digit increases at least, both on and off the exchange, with some insurers saying that they may have to double the price of their premiums in order to make up for the demographics of the exchange, of who signed up for the exchanges.
Mm-hmm. He wants to focus on jobs now and raising the minimum wage. My question is, why haven't they been focusing on jobs, or at least they tell us that things are getting better, and they really aren't. And raising the minimum wage right now, good idea? Well,
first of all, the president wants to focus on anything but Obamacare right now. The president thinks that the race is over with his victory lap. It has just begun. And, of course, the president wants to declare this a done deal and move on to something else. And with regards to the minimum wage, look, the president says that he wants to help the unemployed and he wants to help working people. But, in fact, the CBO got it exactly right. 500,000 people lose their jobs with this increase in the minimum wage. I actually think that estimate is probably too low. And where that job loss is concentrated is in young minorities, exactly the group that with the highest unemployment currently, who you'd hope to be able to move off the unemployment rolls into gainful employment. This takes us exactly the opposite direction. I mean, why the president, in the setting of 6+% unemployment, and again, in young minorities at 20 to 30% unemployment rates, wants to enforce a policy or bring in a new policy called the minimum wage increase that will destroy 500,000 jobs is absolutely beyond me. Mm-hmm. I just have no understanding of why he wants to destroy 500,000 jobs.
Yep. All right, I want to turn to the local level, dealing with the state of Maryland. The Maryland Health Exchange, a total waste of money?
Well, the governor finally used the F word, said it was a failure in his press conference this week, Monday night. It's interesting because for 6 months we have been hearing about how great the Maryland Exchange is and how great it's going to be and how everything's fixed and don't worry about it, everything's working. And then all of a sudden, Monday night, the board comes in, votes, and says, actually, we're gonna just trash the system. Over $100 million spent, probably closer to $200 million. We're just going to trash it and get a do-over.
And they're going to switch to the Connecticut system. Is there an indication that works a whole lot better?
Well, it doesn't do exactly what the Maryland system tried to do. The Maryland system tried to do 3 different things. It tried to do sign-ups for private exchanges, it tried to do sign-ups for the Medicaid expansion, and it tried to do Medicaid re-enrollments. And in fact, Maryland has to do all 3. They decided to put all their eggs in that one exchange basket, and that's one of the reasons why it failed. The Connecticut system doesn't do all that. So Maryland is still left without a system to deal with Medicaid re-enrollment, even if the Connecticut system, translates directly into Maryland and functions in Maryland like it did in Connecticut. It still leaves Maryland without a big chunk of the system, which is the Medicaid re-enrollments.
How much is all of this going to cost us?
Your guess is as good as mine. I mean, just to import the Connecticut exchange is probably the estimates were $40 to $50 million more. Again, we were supposed to have done everything by now, and the state is expecting federal dollars. I would urge the federal government to tell the state, recoup some of those federal dollars we already sent you, or you have to pay the freight on a mulligan. We're not doing it. And then for the other part of the Medicaid expansion, the Medicaid re-enrollment part, that could be another $50 to $100 million to redevelop that system. So the light is not even at the end of the tunnel in terms of the spending in Maryland on these exchange and Medicaid expansion and re-enrollment systems.
All right, so hundreds of millions of dollars are being spent on this. It occurs to me it would have been cheaper just to buy insurance for those without it.
It certainly would. Actually, the best decision would have been just to the state to forego having its own exchange. Just do what a lot of other states did, which is do the Maryland exchange, just do a federal exchange. But again, that decision was made years ago.
Yeah. The failed system was blamed on the private sector, and O'Malley offered this. I want you to hear this soundbite.
Why can't private industry be run like the government?
Why can't private industry be run like the government?
Oh, my gosh, we should just get up and thank God every day that private industry is not run like the government. I don't know. I can't even imagine the context in which the governor, those words left the governor's lips. I can't even begin to imagine it.
Yeah,
maybe he was standing in line at the post office or the MVA when he uttered those words.
He actually said it about the website.
That's pretty amazing.
Yeah. All right, and one other thing before I let you run today. We have a front-page story on billionaire George Soros' effort to have pot legalized across America. All told, he has spent about $80 million since 1994 to promote legalization. He says it shouldn't be a crime. Those who abuse it should be medically treated. Your thoughts?
I oppose legalization at this point. I think that we're just seeing the tip of the iceberg with what the effect of widespread legalization is going to be on, especially on our youth. There's so much medical evidence now that exposure to marijuana, chronic exposure to marijuana in teenagers leads to significant structural changes in the brain, that we really ought to go very slow on this. And I'm not even talking about, the tragedies of increased driving while impaired under marijuana, which we're starting to see nationally, ER visits from marijuana problems. We haven't seen the tip of the iceberg. We ought to go very slow. I think that, Colorado and Washington are the first two states to legalize marijuana. We ought to see what happens in those states over a few years before we decide to jump in and say, yeah, it ought to be legal everywhere. Because I think, if you think about things like effect on the workforce, we're barely competitive in the world in many areas of our workforce. And to superimpose, completely legalized marijuana on top of that, I think is just going to do things that we will wish we didn't go there.
Mm-hmm. I think you're right. Congressman, always good to talk to you. Thank you. Now get to work.
All right. Thank you.
See you later.
Bye now.
Congressman Andy Harris of Maryland.